Okay, having established safe distancing, you can now remove your masks. I'm Dr. Gary Floyd. I'm the Vice Chair of our Board of Trustees. It's my privilege to continue our board proceedings and share some context with you. Since our board chair, Dr. Villarreal, was a candidate in today's proceedings earlier, I was asked to preside over this special meeting of our disaster board during a very historic time for our Texas Medical Association. Our state and nation, as you well know, continue to face an unprecedented public health crisis in this national pandemic caused by the COVID virus. Our fellow physicians and their patients have been significantly affected, so much so that regrettably we had to cancel our 2020 annual meeting along with the TexMed conference that was scheduled to actually occur this very day in Fort Worth. Our TMA Board of Trustees invoked a special provision in our TMA bylaws that was created after World War II to deal with just such an emergency on a national scale by calling us into session and to function as a disaster board. To our knowledge, TMA is the only state medical association with a provision in its bylaws for such a disaster board. We owe our TMA leaders who came before us our gratitude for their foresight in seeing the need for such a contingency and for following through with the necessary amendments to our bylaws that are so important to us today. The Disaster Board's special but temporary status assumes responsibilities of the House of Delegates to oversee and conduct elections and installation of officers and to conduct other necessary business of our association. We take this responsibility very seriously, and we extend our tremendous gratitude and respect to our speaker, Dr. Welke, and our vice speaker, Dr. Holland, whose passion for and commitment to our House of Delegates is undeniable. Due to the pandemic crisis, our actions today are being conducted both in person and by televideo conferencing. Because of the COVID crisis, the city of Austin allows no more than 10 people to gather. So there are only a few members of our disaster board present in Austin today. That would include Dr. Berger, Dr. Fleeger, Dr. Fite, Dr. Welke, Dr. Villarreal, and myself. The rest of our board members are attending online by the video conferencing. Now that you're somewhat caught up with our proceedings today, at this time it's my privilege to thank Dr. Fleeger for his incredible year of leadership. What a year it's been. Not only have you helped our new Executive Vice President and CEO, Michael Darrissett, transition into a new role, but you have admirably led our TMA through this unprecedented global pandemic that swept through our country, dealing a devastating toll on our patients, our physicians, our communities, and our economy. Dr. Fleeger, you have truly been the doctor's doctor. Thank you for representing organized medicine so well this past year. Podium is yours, sir.
Thank you, Gary. Appreciate it. And I have to say I've had plenty of opportunity to say farewell to our TMA staff and our TMA members, and I appreciate those opportunities. At this point, I'd like to say thank you. And always a long list, but I'll try to keep it short and sweet. And first, I'd like to thank my mentors, because I think we all need to have mentors as we go through this process. And those would be the likes of Bruce Malone and Joe Annis and Don Reed, who helped me and guided me along my path. And then, of course, my friends at the Travis County Medical Society, my friends in the Board of Trustees, who have, we've spent a lot of time and gone through a lot of different obstacles together, and we've become quite close. My practice partners who have helped fill in for me as I was out of town a great deal, and certainly my staff who've been very helpful in helping me to keep organized, especially Michelle, my organizer-in-chief. I'd like to thank the doctors, the members who take care of our patients on a daily basis. They do yeoman's work and often are unsung heroes, and I appreciate them for what they do, and I thank them. I'd like to thank our TMA staff. Of course, many thanks to Lou and all he's done for this organization, and we have him in our prayers. And thank you to Michael, who's become a very close friend and has been a great leader in this time of challenge. I'd like to thank Team Fleeger, who traveled thousands and thousands of miles with me throughout this state by car, plane, and everything else, and they've done a great job. I'd like to thank Dr. Fite, my friend and my personal hero, because she is a fantastic individual, as you will all find out this year. And I'd like to tell her, see, I've got this sort of a smile on my face. I saw this on Doug's face when I was in your position. I didn't know what that meant, because this is a very serious thing, right? But the presidents are just very suppressing this joy that they have, because the only thing better than being president is probably past presidents. So with that, my last thank you, of course, to Jamie and my family, who have done a fantastic job in supporting me and making sure I got out the door for the 6 a.m. flights, and just the support was incredible. So thank you very much from that. So with that, those are my thank yous, and now it is time to get serious, okay? And it is my honor to install our 155th president of the Texas Medical Association, Dr. Diana Fite. Diana Fite, as you know, is energetic and passionate about medicine, and her extensive experience in emergency medicine comes at a perfect time with so many unknowns for our patients, our community, our economy, and our profession. Her fighting spirit has brought her to Austin for First Tuesdays, to Chicago for our AMA House of Delegates, and to Washington, D.C. And she has had many stops in between, but more importantly, she's had many leadership roles in her positions with both the TMA and the AMA. And we thank her for all she's done and about to do for us. Like those before her, Dr. Fite assumes the presidency of the TMA with a strong desire to continue improving the patient-physician relationship, and has thoughtfully identified a few areas she'll focus on to ensure this important relationship is protected. She'll discuss those in a minute, but know this about Diana. Diana will focus her presidency and reflect many of the challenges that she faces as an emergency medicine physician, including administrative hassles and physician burnout. Without a doubt, Dr. Fite will be fearless in confronting head-on these issues. I don't know about you, but Dr. Fite plans to tackle making medicine more patient-friendly and restoring the practice of medicine to practicing medicine. I wouldn't let her calm demeanor fool you. She's a fierce advocate and dedicated to our patients, to medicine, and our profession. And with that, please help me welcome incoming president of the Texas Medical Association, Dr. Diana Fite of Houston, Texas. I would, at this time, like to have the physicians in attendance come up to support Dr. Fite. And Dr. Fite, we will remain socially distanced, but
Yes.
At the same time, it is my great honor to administer the oath of office to Dr. Diana Fite. Dr. Fite, do you solemnly swear that you will carry out the duties of the office of President of the Texas Medical Association to the best of your ability, that in all your activities you will uphold the principles and policies of the association, that you will promote unity and cooperation among county medical societies and members of the association and with the Texas Medical Association Alliance, and that you will dedicate yourself and your office to accomplishing the association's primary mission, improving the health of all Texans.
I accept these duties and obligations and pledge my best efforts on behalf of our profession and the patients we serve.
Congratulations. I'd like to point out that we're going to continue our social distancing. For Dr. Fite, we have the presidential pin, which has been passed down for decades, and I get a past presidential pin. Mine's shinier, hers, because it's newer. But ladies and gentlemen, I present Dr. Diana Fite, the 155th President of the Texas Medical Association.
Thank you, Dr. Fleeger, one of the best presidents we've ever had, and thank you to the board and all the audience. Well, I must tell you that I really had my installation speech ready in my mind about 1 hour after being honored to be chosen as president-elect last year. But surprise, the world and our own medical world changed drastically and abruptly since then. So I have a motto for us to go by that is completely different from what I would have said before the pandemic, but is actually suitable for all time. I did not create this, but have read it in several forms in the past. It is, I may not always have a say in what happens to me, but I always have a choice about how I respond to it. Now, we will still go through the issues that I think are especially important to tackle during my presidency. But of course, I understand completely that the current priority is to get us back to taking care of our patients safely. How wonderful it is that Texans adhered so well to self-quarantining and social distancing and stayed away from the emergency departments and doctor's offices if they had symptoms of respiratory illness. How wonderful that doctors agreed to stop all elective surgeries and testing such as mammograms and elective MRIs. How wonderful that there was no surge of COVID-19, and we have thousands of available hospital beds and ventilators in Texas. But at the same time, doctors' practices are in horrible financial shape. Some may need to close down completely. Many employees now have no jobs. Even hospital-based physicians have had salaries cut and lost hours of work because the hospitals are half empty. Many of us placed ourselves and our families in harm's way, prepared to take on the surge of coronavirus that luckily did not happen. So obviously, our top priority is getting back to work, but safely, and getting patients to understand that they need to come in with their chest pain and abdominal pain and stroke symptoms and not stay away due to fear of catching coronavirus, which is less likely to harm them permanently than those other problems. Now, once the pandemic issues are getting under control, let's respond in a stronger way than in the past for what needs to be changed, considering that the sacrifices we have made for our patients at the government's request have cost us so dearly. Electronic medical records have turned us into data processing clerks. Yes, I know we will not be able to get rid of them, but we can insist that they become interoperable between systems so that they will be useful to let us see what diagnoses the patients have and what testing has already been done. Stop making it so hard for us to place orders or describe what is going on with the patient solely because administration and the billing department require clicks for everything, even if the choices are not correct. Let us type in what we want to order and what findings we want to describe and have the clerks find the clicks that fit properly if they must do so. We must stop administrators from holding us to metric systems that are not good for patient care. Hospital-based physicians and physicians now employed by hospital systems are expected to see a certain number of patients within certain time frames or conform with other metrics, or they will potentially lose their jobs. The physicians are doing the best they can, but patient care can be compromised, especially without enough time to properly evaluate or care for some of those patients. Physicians have not received a pay increase from Medicaid in 20 years. Many physicians cannot afford to take Medicaid patients at all, but others have no choice due to their type of practice. Many physicians truly want to help people on Medicaid, but cannot afford to take a loss in order to do so. The legislators believe that physicians will continue to take care of these patients no matter what, and we must be more vocal about not being able to afford to continue this care. The legislators' constituents will end up being more of a financial burden on the taxpayers because they cannot get care in a timely manner. Now, how have we developed such an adversarial position with insurance companies? We should be working together to support each other, but instead, the insurance companies have become our enemies. Patients are paying huge premiums and expect that they are covered for medical care, especially after they have large deductibles to meet and co-pays to cover as well. Then the insurance companies end up paying much less than is billed, or even worse, tell the patient that their visit to the emergency department or their surgery or their procedure was not necessary and is not covered by the insurance company. This even happens with patients in excruciating pain or who come in with chest pain or other potentially serious complaints, and the insurance has no moral right to deny coverage that a patient is paying huge amounts of money for. And what happened to the rule of prudent layperson definition of an emergency? The health insurance companies are now completely ignoring legislation that instructs them to cover emergency fees for a patient who, as a prudent layperson, believes they need to go to the emergency department, even if the final diagnosis is not as emergent as they thought possible. Once the insurance companies realized that there was no or minimal financial penalty to ignore the rule, they now do so without regret. Insurance companies with profits in the billions of dollars have so many legislators paid well with contributions that we are at a huge disadvantage to be treated fairly, as are the policyholders. Our only hope to deal with this issue is to have multiple constituents of the legislators to complain enough that it will make a difference to them. We hear a lot about burnout of physicians these days, even residents and medical students. I strongly believe that burnout can be prevented by participating in organized medicine because it helps so much not to be isolated and to have a group of physicians or residents or medical students trying to make a difference that one physician by himself or herself cannot change. It is amazing how many long-lasting friendships are made by being on a committee or a council in a county medical society or the TMA or the AMA or the specialty society. We need to get that word out right away. This has been the first TexMed meeting that has been canceled since World War II. And this installation and saying farewell to Dr. Fleeger in this manner is both historic and unique. I am honored to be able to share this moment with our members via video stream since it cannot be delivered in person. In case this video is viewed in the distant future and folks don't realize our restrictions, we are limited to a maximum of 10 people in a room. I wish to recognize the presence of Dr. Fleeger and his wife, Jamie, Dr. Linda Villarreal, Chair of the Board of Trustees, Dr. Gary Floyd, Vice Chair of the Board of Trustees, Dr. Arlo Welke, Speaker of the House of Delegates, and my guest, who has been with me through thick and thin since we were in medical school at the University of Texas Medical School at Houston and graduated together 42 years ago, Dr. Michelle Berger, Secretary-Treasurer of the House of Delegates and my guest, who has been my great and supportive friend for many years now, and Dr. Robert Emick, a fellow emergency physician and my guest, who has been a close friend for over 30 years. Also, I am honored to recognize Senator Don Buckingham, the well-respected state senator from District 24, who is an oculoplastic and reconstructive surgeon and has been a friend for many years. Thank y'all. But I do miss badly my family and several other close friends who I'd been planning all year long on being here. Those friends would be Dr. Pat Woods and his wife, Dr. Dana Woods, Pam Munson and Matt Munson, Linda Holler, my best friend from Amarillo since we were in junior high school together with her husband Harlan Holler. And Linda and Harlan were planning to bring along my mother, Sylvia Ellis, who is 92 years old and was really looking forward to seeing me be installed as TMA President. Also missing from this event are my 8 children, Tracy Patton, Anna Floyd, who passed away, but was going to be represented by her husband, Scotty Floyd, and his mother, Debbie Holman, and my grandson, Ryan, Arthur Patton with his friend, Brittany Bolsifer, Elizabeth Carlisle with husband, Chris Carlisle, and my grandchildren, Michael, Lily, and Catherine, Alexandria Patton and her friend, Jake Bice, Renee Munoz with husband Christian, Aaron Patton, and Amanda Patton with her friend Sarah Goodell. Some of the other grandchildren were too young or otherwise would not have been able to attend. And thank you to God for letting me continue to pursue my purpose in life, which was to be a physician, and now as the TMA president. Thank you.